fun new way. Wave and cheer from the comforts of your car at the Grand Reverse Parade, presented by Kinross Fort Knox Gold Mine, where spectators will drive through a maze of floats at the Tanana Valley Fairgrounds. You can track down your favorite eats and vendors at the citywide street fair that will be presented by ConocoPhillips Alaska and Alaska 529. And finally, you can bet on your lucky duck to win big at the Rubber Ducky Race presented by Sunrise Bagel and Espresso, while you keep our community healthy by maintaining physical distance, masking up, and keeping your hands as squeaky clean as can be. With so many changes to the regularly scheduled Golden Days programming that we all know and love, we're asking you to keep an eye on our website, on our Facebook page, and our weekly newsletter called The Scoop, so you don't miss out on any of the details that are coming your way. You can check your email soon and see the latest announcements from the Chamber. We're excited to be able to find many alternatives to traditions that allow us to continue to celebrate and connect as a community at a time when we're feeling less certain than maybe we ever have before. You can find information about all of the Golden Days events and more at our website. The Golden Days website is fairbankschamber.org/Golden Days, or you can call or email the staff at any time with any questions or on ideas on how to call for support. Now we'll move to our main presentation. If you're watching this presentation live, go ahead and type any questions that you may have in the chat section so that we will share them with our presenters at the conclusion of this presentation. As businesses have reopened and employees have started to phase back into the workplace, many questions may arise around workplace liability and what the expectations are and should be. Today, we'll hear from Christina Miller and Bob Groseclose of CSG Inc. to answer some of those questions and to give us their best and current information at this stage in our recovering economy. Christina Miller, Esquire, was born and raised here in Fairbanks and graduated from West Valley High School. She received bachelor degrees in both English and philosophy from UIF. She got her law degree from the William Mitchell College of Law and has been admitted to both the New York and Alaska bars. Christina has been with CSG Inc. since 2016. She's married to Representative Grier Hopkins, and they have 2 dogs. She's a board member of both the Greater Fairbanks Chamber of Commerce and Breadline here in Fairbanks. She enjoys yoga, playing sports, reading, keeping houseplants alive, and learning how to bake sourdough bread, just like everyone else at home these days. Bob Groseclose also is a born and raised Fairbanksan. He's a Lathrop graduate and got his bachelor's in economics from the University of Oregon. He was a staff assistant to U.S. Senator Ted Stevens and continued studies at the Netherlands International School of Business, Hofstra Law School, and received his law degree from the Catholic University Columbus School of Law. And he has had his private practice with CSG Inc. since 1976. Bob is married to the lovely Barbara Schumann, and together they have 2 daughters. They enjoy all things Alaskan. Thank you so much to Christina and Bob for joining us today, and I will invite you to now take it away.
Hello, Fairbanks Chamber, and thank you for having us today. Next slide. So I'm Christina Miller, and this is Bob Groseclose.
Hello, hello. Here we are, masked up, ready for anything that comes our way.
So we're here to talk about business and employment liability in the workplace, in the era of COVID-19. So we're panning the pandemic for legal nuggets. Next slide. And as all attorneys do, we have a disclaimer for our presentation. Remember, this is for informational purposes only and not legal advice. No attorney-client relationship is created through this presentation, and please contact your attorney if you have any specific legal questions. Next slide, please. And as we pan for legal gold nuggets in the time of COVID-19, what to keep in mind is that what appears to be gold today may be fool's gold tomorrow. And why is that? Next slide, please. Well, first of all, there's no rule book for COVID-19. Just like there's no rule book for COVID-19, there are no legal rule books for guarding against complete and all liability during the era of COVID-19. And second, the facts are changing with scientific research, with statistics. And with this, Also, the law is changing. There are new legal issues arising. There are new laws enacted, so we need to stay up to date. So although there's no way to guard against complete liability, there are ways to mitigate liability, to shield yourself from such risks. Next slide. So risk management. So there is hope. You can manage legal risks as a business and employer during this pandemic. But how do you do this? How do you shield from all the risks as much as you possibly can? Next slide. First, establish that COVID-19 is a threat. Second, implement reasonable safety measures in your workplace. Now, how do you do this? What are reasonable safety measures? And what are the risks that you are guarding against? Well, there's one place we can start with. Next slide. Looking at government mandates. Are there any current mandates relevant to your business in effect? How does that affect your business? Current mandate, for example, is the 72-hour testing mandate for anyone traveling into the state. How does this affect your business? Do you have clients, customers, contractors, or employees traveling out of state and going back into state? And then what are the risks of these mandates? Depends on the mandates between fines or lawsuits or other risks. Next, of course, there's new legislation. First, there's the Families First Coronavirus Response Act. Next, there was the CARES Act. And then there is the Alaska response to COVID-19, which is Alaska Senate Bill 241. And lastly, there's the HEROES Act that is not yet passed and not law, but something to keep in mind and make sure that you're aware of if it does. Next slide. So we'll briefly go over some of these acts and what it might mean to your business and things you might want to keep in mind to avoid risks. So the Families First Coronavirus Response Act is an act that expands sick, family, and medical leave for COVID-19 related reasons. This means when an employee must quarantine for COVID-19, that sick leave or medical leave or family leave is implemented, the expanded version. If an employee needs to care for someone who's in quarantine, or if there are school children or childcare that's not available for your employees because of COVID-19. And this is for all employers that are not exempt from this act. You have to look at the act specifically to ensure that you are or are not covered under this act. I encourage you to look at further information for this act as well. And this was effective on April 1st, 2020, and it will end December 31st, 2020. Okay, next slide. Next slide, please. Let's see. All right, the CARES Act. I'm sure everyone knows about this, but we'll briefly go over this. It was enacted on March 27th, 2020. It was a $2 trillion relief act aimed at providing relief to individuals, businesses, and state and local governments. It also expanded some consumer protections, which included foreclosure moratoriums, a consumer right to request forbearance, and a moratorium on some evictions. Next slide. Next, we have the state response to the coronavirus pandemic, Alaska Senate Bill 241. This bill was implemented to increase health, safety, and economic relief measures during the pandemic. Some of the measures of this bill included halting evictions and foreclosures caused by COVID-19 and protecting some borrowers from COVID-19 financial troubles, and also outline price gouging. Of course, there's much more to this bill, but this is just a brief overview for you to keep in mind. Next slide. Then we have the HEROES Act, which is not law. It is not yet passed. And the measures that I'll go over are only proposed measures into the law and not current law. So it has passed the House, and what was proposed in the HEROES Act is $180 billion in grants for essential workers, including healthcare workers. A second stimulus check, funds for states and localities, an extension of the $600 federal unemployment compensation and benefits until 2021. So again, this is not yet law, and it may not become law. It really depends, but it's good to, like I said, earlier to keep track of new laws enacted that may impact your business. So the next place to look to guard against legal risks would be, and please go to the next slide, is OSHA. So every employee has a right to a safe workplace. OSHA requires employers to maintain, comply, and ensure. So to maintain conditions or adopt practices reasonably necessary and appropriate to protect workers on the job, to comply with applicable standards to the workplaces and establishments to ensure the safety, and then to make sure that employees have use and access to materials, tools, and protective equipment they might need to ensure that there's a safe environment. Now, this seems very broad, but OSHA has a website that has a guide for businesses during the COVID-19. It's posted online. I encourage you to review it, as we don't have time to review it currently during this presentation, but we will go over a few sections that may be relevant to you. Next slide. So in this guide provided by OSHA, they look to name several sections that might be relevant to your business, but of course this depends on what risk factors are in your workplace, how high risk is it. It's always dependent on the degree and the facts of the situation. But these are just some things to keep in mind when looking at your workplace and whether you're taking reasonable measures to ensure that you have a safe workplace for your employees. So the first measure they name is the recording and reporting occupational injuries and illness. So how or if you're reporting occupational injuries is something you should look at and question. Next, are you providing personal protective equipment? Are employees supposed to bring personal protective equipment in? What does that look like for your workplace? To what degree do you need this equipment? And then eye and face protection, also looking at your workplace and whether that's necessary or whether you need to provide that. Respiratory protection, sanitation, what are your sanitation procedures to ensure that you have a reasonably safe workplace? Are you cleaning regularly? How are you cleaning? What guidelines are you using? What resources are you using to provide the sanitation? Also, a great example of having signs that remind patrons and employees to abide by these new workplace guidelines to stay safe is having signs. So what kinds of signage do you have? Do you have something saying, reminding people to stand far apart, like the farmer's market? It's a great example, the Tanana Valley Farmers Market, and a sign for people to remind them to keep their distance. So what's in place there? Next, what happens when an employee gets sick or injured on the job? Next slide. Well, workers' compensation is what covers employees when they're on the job and they get sick. So if an employee gets injured or sick at work, then it should be covered under workers' compensation insurance. Under Alaska law, employers need to have workers' compensation insurance to cover these claims. That includes medical costs, that includes sometimes compensation and sometimes pre-employment claims. And so employers should seek workers' compensation insurance. If you don't have it already, please look into that to get that as well, to avoid liability. Next slide, please. So what type of lawsuit may be a risk factor during COVID-19 to a business or employer? We call this a negligence lawsuit. So that means someone can bring a lawsuit against a business under this claim that there's some kind of negligence being perpetrated by the business. So who can bring a lawsuit against this business? Maybe a customer, maybe a client, maybe a contractor. Employees, like I said, are covered under most cases if they get ill under workers' compensation, and OSHA provides protections for them. But how do you protect against this type of lawsuit? So under the law, normally you look at whether or not there is a duty. Is there a duty to take reasonable measures to guard against the transmission of COVID-19 in your workplace? There is no law on this currently, But we do have laws about negligence. So we look at what is reasonable care. And it's not usually taking all possible measures you could think of to stop the transmission of COVID-19 or a danger, but what's affordable, what's practical, what's not burdensome, what are reasonable things that someone as a business owner could take to avoid transmission of COVID-19. And understanding what the requirements under negligence law is whether, who are you protecting and why and how. And this is on a case-by-case basis completely. So there are no laws or Alaska case law talking about negligence, but we do have a 1998 Alaska Supreme Court case that talks about whether or not there is a duty beyond those to keep employees' families safe from an infection, as well as the employee themselves. In this case, it states that this duty does pass to, you can pass to your family depending on the situation. So please go to the next slide. So is there a duty to take reasonable measures to minimize the spread of COVID-19 in the workplace? Well, the answer is yes. Is there a duty to employees, families, clients, customers, patrons, and contractors? Well, likely or maybe. It really, really depends on the situation. You can't say either way, but at least in this case, the court did find that there was a duty to take reasonable measures to minimize the spread of the disease, to make sure it doesn't extend to an employee's spouses. And in this case, specifically, it was 2 nursing assistants who were in a long-term elderly care facility, and there was a staph infection outbreak there. And of course, the nurses were covered under workers' comp, but what about their spouses that got infected? The court did find that there should be some reasonable measures taken to protect the spouses from the staph infection. And whether that translates to what's currently happening, it will also depend on the court as well. And the court imposed, again, a duty of care that's so burdensome and economically unreasonable for the businesses. But what's reasonable? What are the risk factors? And what can a business practically do to avoid these risks? Next slide, please. So the point is that what we can do is that we can manage the risk. We can't absolutely guard against it, just like we can't absolutely guard against the transmission of COVID-19 in a medical sense, but we can take measures to protect ourselves. So some reasonable measures to protect employees, families, customers, and clients and contractors is something that would help in the situation of risk of legal liability. Next slide. So what are these reasonable measures? And where can you look to find this answer? Well, first we have Dr. Ann Zink, our Chief Medical Officer for the state of Alaska. There's a hashtag Think Like Zink. So what would Zink do with your situation? What guidance has she given as far as workplaces or protective equipment or policies? What are reasonable and affordable and practical measures you can take there? Also, if there's industry-specific guidance, that can also be helpful. So if you are part of a group that is the same field as you, maybe CHAR or profits or otherwise, like what are they doing? What's the guidance that they're providing to keep the workplace safe? And what's practical for you? Next, also a great resource is the Foundation Health Partners. They have a fantastic business toolkit on their website. There's an email there, a resource where you can request guidance from a physician and maybe taking some of those measures that a physician says a workplace can do to help stay safe, but also not only guard against transmission, but guard against legal liability. So whatever you can do to guard against transmission in the workplace will also increase the guarding against legal liability. So it's one and the same. Similarly, next slide. So the CDC is also another great resource. They have a section in their website also discussing workplace measures that you can take. It talks specifically about some, such as restaurants, things like that. So I think that would be also another helpful resource. And these CDC guidelines could be seen as reasonable measures as well, and not only meet your workplace safety, but also maybe limit your liability and the risk of any legal action. Next slide. So when you're implementing these new measures that you might look to from the website or from other healthcare professionals, you need to make sure that you think about what are the risks of implementing measures also. So the next step. So say it's been recommended that there's some screenings or reportings of illnesses or some kind of test, maybe there's a temperature test. How do you keep your employees' medical information confidential? How do you not violate HIPAA? Does your business plan include mechanisms to protect confidential medical information? That's just a question you need to ask as we go through this process of reopening and doing it safely. Next slide, please. Additionally, are such measures incidentally discriminatory? As an example, if you're reopening and you're slowly allowing some employees to come back to work as they've been working from home, are you only allowing or asking younger employees into the workplace? Because for whatever reason, maybe there's an impression that at higher age, maybe there's a higher risk of injury from transmission. Is that discriminating? Just make sure that even if there's not coming from a place of discrimination, it may have some kind of impact of discrimination. Another example is if a business owner or employer has an impression that an employee is immune compromised and they're not as healthy as other coworkers, so they should stay home. Is that discriminatory? Next slide. And then we go into the Americans with Disabilities Act. So is there an incidental discrimination based on a perceived or actual disability when you're implementing these measures? So that's something that's tricky, but I think we can all overcome just by keeping these questions in mind and checking each step of the way, what choices a business owner is making while they reopen, what measures are in place, what is reasonable, what is not reasonable, looking to the resources that you already have in your community. We have great advice that's online and available, a lot of people willing to talk to business owners and help individuals in creating a safe and healthy workplace and helping with integrating employees back into the workplace. And again, this presentation is not comprehensive, but it is a brief overview and is just for informational purposes only. Business liability during the pandemic will change and the law will continue to change. So it is up to our community and to your resources to try to stay up to date, not only with the scientific resources and updates, but also the law. But the point is also, even though we can't guard against absolute liability, by implementing reasonable measures, we can guard against COVID-19 transmission and in the same time, help guard against legal liability. Next slide. We were given some questions that came from the chamber members of the chamber that we thought we would address now, just to make sure we talk about these. So waivers is a question. Can you have an employee sign a waiver saying that if they get sick at work from COVID-19, will they waive any legal action against the company? Well, that's not enforceable, actually. Even if you have them sign it, it's not something that's enforceable. Can you have contractors or clients or customers sign a waiver against legal liability? Well, you could, but it's not absolutely going to guard you against legal issues, maybe to a degree. And it really depends on the situation. It depends on the business, what you're asking them to waive, and to the degree it's enforceable and how that applies to the actual workplace actions. And also maybe think about, is that good for a business? Next, we had a question about unemployment benefits.
Maybe before we leave that, Christina, if I could jump in.
Oh, yeah.
Our Supreme Court cases are pretty clear, and I think this is pretty much the rule across the country, that you cannot get a release for your active negligence, at least not in advance. So you cannot ask somebody to waive your active negligence unless, and one distinction, and we see it a lot in the sporting world, whether you're running a downhill ski operation or you're running a foot race, if the active nature of what you're trying to release a claim from is an inherent risk of the sport. If we use the analogy of a ski resort, if falling with gravity and going over a bump on a ski slope is inherent to the sport of skiing, then those sort of waivers have a chance of success. If you're trying to have somebody waive any claim because of a failure on your part, and in the COVID situation, if you're a healthcare provider and you're on notice that having certain safeguards in place, whether it be protective equipment or a protocol to follow, whether it's requiring masks, sanitizing periodically, having your employees tested, if you then just look the other way on these directives, you can't hope to find shelter in a waiver that you present to somebody in advance of employment or in advance of rendering service to them that is going to be enforceable. I mean, the court's just going to look at it and say it's void as against public policy and we're not enforcing it. So then you have to kind of ask yourself, well, what's the value of the waiver? And is it somewhat off-putting when you ask a customer or an employee or anyone visiting your facility to sign something of the sort? I think you're better off, if you're going to use anything that approximates it, to treat it as if you're warning them or at least pointing out to them that there are limits within which we all have to function with COVID. We have some general guidelines, but none of them are foolproof at this point. We don't know the full extent of how the infection transmits. We like to think a 14-day quarantine is adequate, but there are instances out there where people contracted 17 days later. And I'm sure there are all sorts of examples. We've seen them all play out in the news. So again, you can't really think that getting some waiver is going to be a magic solution or the silver bullet, so to speak. It's just not.
Yeah, thank you, Bob. And the next question was about unemployment benefits. So if an employer has had to shut down because of COVID-19 pandemic and they had to lay off workers, and then their workers may have gone on unemployment benefits, and the employer asked the previous employee, hey, I'm reopening, I would like to offer you a job. And the employee says, well, I make more money on unemployment benefits than I do working for you. Well, what can an employer do? Well, the unemployment office asks the employee to always report when they receive a job offer and whether they've accepted it or not to determine whether or not they'll continue on unemployment. So an employer can report to unemployment and say, I offered a job to this employee and they refused it, or the employee themselves should be reporting it to the unemployment office. Anything with it?
No, I think that pretty well covers it. It's an obligation that the employee has to be forthright and to update them, and I don't think the process is going to be well served or dignified later by any ruling that excuses someone from reporting that information. And by the same token, an employer who reports it is simply doing what the law requires anyway.
And then we had a question about working from home. And really, this is a tricky question because it really depends on the workplace, it depends on the employee, employer, that sort of thing. But say the workplace is reopening and you've had some employees work from home and they really enjoy it. You know, for what reason? And so they say they want to stay working from home. Should they be allowed to? Can you make them work at the workplace? Well, it depends on also, does this employee have some kind of anxiety disorder where maybe going into the office during the pandemic might increase their mental anguish or injure them in that way? Well, then that goes to the ADA question. Is it a reasonable accommodation to allow them to work from home because of this medical issue? So it really depends on the situation. And would you like to add anything?
Well, the only thing I'd add is to use the buzzwords of the Americans with Disabilities Act. If it's an unjust burden or an undue burden, then you don't have to accommodate. But first, there has to be a disability or something that impacts an essential job function, and commonly that you can seek confirmation of that after the employee raises it and requests accommodation. You can ask that it be confirmed through medical input. So someone just can't simply say, well, gee, I've really enjoyed being at home and watering my plants and cooking my own lunch and avoiding the commute, and all of this has been great. And oh, by the way, I caught my favorite soap opera. I mean, that's not going to cut it. They're going to have, I mean, you're still in charge of your workplace, and there's certain essential job functions that require people be there. You know, each instance is going to be case specific, and you just have to kind of work through the analysis to get to what you hope is the defensible answer.
Great. And so we'll take more questions after this, but you can go to the next slide. We just want you to know that you're not alone. Next slide. And we're here for you. And then maybe go to the last two slides there. Go through those. Thank you for letting CSG talk to the chamber today during lunch.
Yes, thank you. And thank you, Christine.
Thank you so much, Christina and Bob, for joining us here at the chamber today for this presentation. I know we've been getting a lot of questions, and there's been a lot of dialogue around members having questions about what they can and can't do, or what they should and shouldn't do. And I am looking, we've had a couple of requests in our chat box for any questions from our audience that's watching right now. So if you are watching live and you have any questions for Bob and Christina, you can type that into the chat box, and Janelle will moderate those questions for the audience. And those do typically start to come in at the end of the presentation. But I'll go ahead and kick it off with a question that I hear pretty often, which is, if you are an employer or a manager or a business owner of any kind, and you have an employee that presents to you their concern around returning to the workplace, whatever the concern is, do you have any just kind of general best practice advice for that person in a way to have a conversation with the employee? Because I think there's a lot of uncertainty around all of these issues. So do you have anything that you could give as advice to those employers?
Well, my advice would be to have the discussion and you know, be open and listen and do your best to try to diffuse what otherwise could become a problem. And it's not always about being right. It's also about avoiding the heartache of being sued, because that's expensive, it's distracting, and it takes you off task. So if someone has concerns, as we all do, I mean, hey, this COVID thing it's an evolving, moving target, and it's understandable that people might have trepidation about putting themselves more at risk and leaving the home. You know, let's face it, is going to expose you to others. And yes, we have our our distancing and our rubber gloves and masks, but we're talking about microbes here. And if someone has is a germaphobe, as I might refer to them, unless it's a diagnosable condition, though, they really need to just sort of suck it up and go with what the protocol says. And that's the best we have to work with at the moment.
Thank you for that. It looks like Janelle does have one question, and it looks like there might be some others that are chiming in. So I'm going to go ahead and pass it over to Janelle to moderate the rest of our Q&A here today.
Sounds good. So one question that has come up quite a bit, and I apologize if you covered this to a certain extent in the presentation, but I know it's something that's a priority for a lot of folks. What are the official responsibilities of an employer if an employee has lost their childcare, either because of schools or camps or their childcare facility closing or not accepting as many children? I know that's causing a lot of angst for people.
I'll take a stab at that.
So
Sounds like a family medical leave question.
Yeah. So the Family Medical Leave Act covers, what are your responsibilities? First of all, you want to ask, is your business qualifying and for that act to be enforceable against your business? So there's a lot of government resources that has sort of an outline and tells you what businesses are exempt from this and what businesses need to comply with these, but there is an expansion of family sick and medical leave, and it does have a clause in there that that leave needs to be extended for purposes of loss of childcare due to COVID-19, and to what extent really I think depends on, you'll have to look specifically at the act, and then you'll have to look more into your workplace and see what can be accommodated on both ends, making sure you're complying with the law. Under state law, there's nothing currently that I know about. And then again, this is law is a temporary measure, so it's only till the end of this year currently. So I would ask that you look at your current work structure, make sure you look at all the resources available online for family medical leave, or actually go to an attorney. I think they would actually have the advice you're looking for to be more specific and give you a practical guide for how to avoid risk in that way. So
one distinction, and Christina, if you could speak to this, would be it's one thing to grant leave that's unpaid, and many employers might say, well, that's a little more tolerable, even though I need my staff here. If someone has a family crisis of sorts, and childcare, frankly, can become a family crisis, it's one thing to say, okay, you don't need to report to work. It's on your time, not mine, and I'm not paying you. You're on unpaid leave. Part of the CARES Act, though, unless I misread it or misunderstood it, entitled people to be off work for a fixed period of time where payment of their normal wage was required to be made.
Yeah.
Now, have we rounded the corner on that? That's no longer an entitlement?
I'd have to look specifically at that section, but yes, there is a time period where if you do have to take time off work because of those reasons listed, so not having childcare, that is paid time off. So I would look into that as well, make sure that you're following that and when that end date is.
Okay, thanks for that. So one thing, I don't know if you'd want to speak a little bit to this. It sounds like kind of a theme of what you're saying is look at the details, that all of these legislation will have guidelines in them about who it applies to, who it doesn't, what are the specific employer's responsibilities if they fall into certain categories. But it sounds like basically you have to look at what your specific situation is in order to answer a lot of those questions. Is that accurate?
I'd say yes, that's accurate, because some tests deal with how many employees you have. And I realize that the CARES Act and some of the more recent things have blurred that and muddied the waters, but it used to be traditionally, like the ADA used to require for certain implemented requirements, X number of employees that were part of your payroll. So if you're under that, technically you dodge that requirement. And so each each employer needs to kind of get an assessment of both the industry they're in and because there may be trade practices that are going to establish, you know, how to remain competitive as well as be in legal compliance.
Okay, thanks for that. So the chat, mostly we're just hearing from people saying thanks for the information. It's a great overview. I guess as one final thought, is there any online resource or somewhere that you would suggest that people go if they want to learn a little bit more, or try to make that determination of whether they can figure it out on themselves or if they need to seek legal advice?
Well, I think Christina hit on it with her presentation, but I would first go to the industry leaders in the business world that I'm in. So if I'm a restaurateur or if I operate a bar, there are likely outlets where the wheel is being invented or has been invented, and you can find some comfort in sharing your perspective with that of others in a similar situation. You know, that's kind of what I think is more of a practical, you don't necessarily, it's not running off to a lawyer. It's first taking stock of what resources you really already have available to you. And then, and I tend to think the trade organizations would already be dialed in on the legal requirements, but to the extent they're not, and you want to satisfy yourself with what those are, the place to really start in Alaska is with our own medical officer, and Christina provided the link, what'd you call it, the hashtag?
Think like zinc.
Think like zinc, you know, and zinc, you know, she's our own superstar when on this issue, and I think has been well received in terms of her thoroughness and scientific report and scientific approach, because that's ultimately, you know, what we want. We want decisions based on hard facts and science, and not just by gut instinct in all instances.
Great. Well, thank you again so much to Christina and Bob. Thank you for saying yes when we reached out and asked for your support. This has been a topic that has been coming up in many of our conversations here at the Chamber. So not only was this really relevant information, but also incredibly timely. So I will echo the sentiments coming in on the chat that this was really helpful, and we appreciate the great content. For those of you that are watching live, you did see Katie from our office had taken a lot of the links that Bob and Christina referred to and posted those in the chat box. And also, if later on you want to look, we have a lot of that information. I can't guarantee we have all of it, but I think we have a lot of those links on the Chamber's website as well. If you go to fairbankschamber.org/COVID-19, we have a lot of resources that are useful for businesses, and a lot of these links are located on that website. So thank you again so much to you. We really appreciate it. Now I'm going to shift gears and do something. Most people probably noticed we had a little bit of a bumpy start to our meeting today. We're having some technical difficulties. And so there was a couple of things that we mentioned early on in the meeting that didn't make it into the broadcast. So those of us here in the meeting, we all heard it. We've heard it more than once, but we're going to go ahead and share it again for our audience that's listening in today. I just wanted to let folks know that here at the Fairbanks Chamber, our Government Relations Committee sent a letter to the administration urging action that would lead to faster turnaround times for test results for COVID-19. As our businesses are reopening and looking for assurances that their employees and their customers are protected, more rapid testing is an essential tool in our reopening efforts, and that will help to keep our total case counts low. So our letter suggests possible options that include increasing capacity of the state's virology lab here in Fairbanks, or ensuring that other labs here in town have access to the reagents and other supplies so that those tests can be analyzed locally, i.e. more quickly. And we recognize that there have been some very applaudable efforts made so far, but we also recognize that there's an opportunity here for more improvement. And the next board meeting for the Fairbanks Chamber is on Monday, June 19th. And then on the events side of the house, I think our live broadcast picked up the middle of this next announcement. So I'll just kind of hit the first part of it here, that on the events side of the house, we did make an exciting announcement yesterday on our Facebook page. So while things might look very different this year, we are excited to announce that there are golden days ahead. So with a bit of creativity and a little help from you all, we'll be enjoying classic Golden Days events in a safe, responsible, and fun new way. You can wave and cheer from the comforts of your car at the Grand Reverse Parade that this year is presented by Ken Ross Fort Knox Mine at the Tanana Valley State Fairgrounds. You can track down your favorite eateries and vendors at the Citywide Street Fair that's presented by ConocoPhillips and Alaska 529, and bet on your lucky duck to win big at the Rubber Ducky Race presented by Sunrise Bagel and Espresso. And we're asking our community to help support these events, not only by your attendance, but your attendance that also includes attention to physical distancing, masking up, and keeping your hands squeaky clean. And then the next thing I wanted to do before we wrap out today is just kick it back over to Brenna so that she can recognize our new and renewing members like she does every week. Brenna?
Thanks, Marissa. So before we go today, we'd like to welcome 2 new members to the Chamber, the Lodge of Black Rapids and the State of Alaska Division of Vocational Rehabilitation. Welcome to the Chamber. We'd also like to thank our renewing members, Aurora Energy, University of Alaska Foundation, Fairbanks Rescue Mission, Catholic Bishop of Northern Alaska, Friends of the Tanana Valley Railroad, and Willow Physical Therapy for renewing their memberships. We'd also like to welcome some new members to our 110% Club, which means these members donated above and beyond their membership investment to help us with our advocacy actions. And those are R&M Consultants, Grace Mender Realty, Fairbanks Rescue Mission, Anchorage Daily News, and Fairbanks Cardiology. Thank you and welcome to the 110% Club. This week's membership minute is all about leaning into your creative elements. Our business community is already known for their creativity, but when reopening and operating, make materials that are custom to you. We saw 2 weeks ago that the farmers market created an Alaska-themed distancing sign and sprinkled a little humor on their posters to give an extra welcoming atmosphere to folks that frequented the market. They used examples like 1 snowplow away for social distancing or 10 extra cups. So we encourage you to be creative and make it yours. Back to you, Marissa.
Thank you so much, Brenna. Final thank you to Christina and Mike. We really support your knowledge and your expertise on this topic. Sorry, I said Mike. I meant Bob. I don't know why I said Mike. Christina and Bob, thank you. And then as we close out today, I just want to make sure that our community is reminded that supporting local businesses during this time of reopening is crucial, but it's also crucial that you do that to the extent that you're comfortable. I think in these times, it's incredibly important for us to all remember that as we reopen our economy and reopen our businesses, it's important to still remember the importance of masking up, maintaining physical distancing from one another, and keeping our hand and face hygiene tactics sharp as we move through the next few weeks. This is really going to help us lower the curve. It's going to help, or flatten the curve, I should say. It's also going to help our businesses to remain open and ensure that our community can start slowly getting back to a more normal atmosphere here. I do want to ask everyone to please join us next week, Tuesday, June 9th, for the latest community update from Foundation Health Partners, where we're going to hear from Steve Leslie, he's their CFO, and also Dr. Kate Carey. They will be updating us on the impact of the health mandates on the Tanana Valley Clinic and detail the safety precautions that have been implemented to protect patients, and also discuss available resources for business owners. We hope to see you all again next week. Thanks for hanging in there while we had a little bit of a bumpy start today, and be well, Fairbanks. Thank you.